Here is your question. All right. So if you've read and understood considering its surgical anatomy station, kindly please tell me what are you looking at?
So this is a cut section of thorax
Yes.
from anterior view,
Yes. And
some thoracic viscera is there, both lungs and heart.
yes. And
Yeah.
yes. All right. Can you tell me about the lungs? If you can identify which one is which one, and if you can tell me the parts of the lungs, both right and left.
Okay, ma'am. So yeah, is number 18 is superior lobe, number 20 is middle lobe of the right side, and
Yes.
number 9 I think is the inferior lobe. And the left
Okay.
side we have only two lobe.
Yes.
Number 17 is superior lobe, and number 1 is inferior lobe, and number 22 we can say is lingula.
Lingula. Okay. What is exactly lingula?
So lingula is a representation of middle lobe of the right lungs to the left lungs.
If you're asked to tell me the surface anatomy of the lung, how would you explain it?
Okay, so for the lungs, it will start from the apex, is 2 centimeter above the supraclavicular region, and then it in the mid clavicular line, it goes up to the sixth intercostal space. In mid axillary line, it will be goes to the eighth intercostal space, and on the mid scapular line, it will be up to the 10th intercostal space.
All right. Okay. All the organs of the chest or the thorax are divided in certain categories. Have you heard of the word mediastinum?
Yes.
Can you please explain or
So
define the term?
mediastinum is the place in between two lungs
Yes.
and the pleura. So it divided into different part. It's superior mediastinum, is anterior mediastinum, posterior mediastinum, and middle mediastinum.
Can you describe the boundaries of the posterior mediastinum?
Okay, so posterior mediastinum is bounded by posteriorly by the lower 8 thoracic vertebra, anteriorly by the pericardium,
Yes.
and both side is by the lungs and pleura.
Okay. And what are the contents of the posterior mediastinum?
So it will contains vagus nerve, thoracic duct, azygous vein, sympathetic trunk, esophagus,
And descending aorta?
descending aorta.
Yes. Or sympathetic trunk as well. Did you mention that?
Yes, ma'am.
Okay, good. All right. Can you please tell me what are the structures which pass through the hilum of the lung?
Okay, so is main bronchus, right and left, and pulmonary artery and pulmonary veins, and some lymph nodes.
What do you understand by the term pulmonary ligament?
So pulmonary ligament is the thickening of the pleura in the inferior part of the lungs,
And what function
and
does it serve?
is joined with the diaphragm.
Okay. Any purpose, any function it serves? You can tell me any
It
physiological function?
helps to uh, increase the cavity during dilatation of the pulmonary vein.
Yes, it allows expansion of the pulmonary veins during increased blood flow. All right, can you please tell me how many bronchopulmonary segments there are in each lung?
It's 10 bronchopulmonary segment.
Right. Can you tell me the nerve relation anterior and the posterior to the hilum of the lung?
Okay, so anterior is the phrenic nerve and posterior is the vagus nerve.
If you can please look at this image and identify these three arrows, red arrows. What is
So it
number
is
one, please?
a lateral prosection of the thorax.
Yes.
The number one is archoesophagus vein. Number 27 is a
Yes.
sympathetic trunk.
Very good. And three.
And number 3 is a great splenic nerve.
All right. Can you tell me which, all right. What exactly are you looking at here? This
This is
organ
the
that-
heart.
Yes. Please tell me the parts of the heart.
So parts of the heart, we have a 4 chamber, right and left atrium and right and left ventricle.
Yes.
And it has 4 valves as well.
Yes.
And it has aortic, aorta,
Yes.
ascending aorta.
Yes. If you're looking at this area over here, would you be able to identify the structures? Number
Yes, ma'am.
2, 15, and 18, 12. If you
Okay,
can
so-
identify what apertures these are.
So number 2 is a pulmonary vein, superior pulmonary vein. And number 12 is inferior pulmonary vein. Number 15 is pulmonary artery.
Yes. All right. If you can tell me what is sympathetic trunk?
So sympathetic trunk is a nerves.
Yes. From where it
Yes.
starts and how it goes, any course you can tell me?
Okay, so it arises from the spinal nerves. I mean, spinal nerves from the foramen of
If you can't remember,
intervertebral.
then we can come back to this one later.
Okay, ma'am, yes.
All right, good. Now, if you are looking at this image over here on the left-hand side, could you please identify these circles?
Number 9 is pulmonary trunk.
All right, 8, 7.
Is conus medullaris.
One,
I mean,
please.
conus arteriosus.
One.
One is anterior septal cusp.
5, please.
5 is chorda tendini.
Okay, and 2, please.
Is anterior papillary muscle.
What is the function of this chorda tendini?
It prevents regurgitation of the valve, and it helps. It helps to.
If you can't remember, then ask that you'll come back.
Okay, yeah, I will come back later.
Let's save your time. All right, looking at the image here on the right-hand side, what is this 5, please?
This is
Auricle. Okay.
auricle of the right atrium.
Yes. All right. Can you please tell me the blood supply of the heart, please?
So it get blood supply from the right and left coronary artery, which is a branch of ascending aorta, and venous drainage is by 3 vein, is anterior cardiac vein, great cardiac vein, and middle cardiac vein.
Okay. Right. That is how quickly you told me the blood supply of the heart.
Should I mention the branch or is okay?
Yeah, you can if you can tell me which exactly branch you are looking at over here.
Okay, this one is anterior intraventricular branch of left coronary artery.
Yes.
Left coronary artery.
Good. Okay. So mostly heart is supplied by which coronary artery?
Mostly is by right coronary artery, 60%.
Okay. In rare conditions?
Left coronary artery can give maybe 50 to 60%.
Yes. But this is not fixed. It varies person to person.
Yes.
Okay. Right. If you can tell me what do you understand by the term subclavian steal syndrome?
Due to the compression by any tumor like Pancoast tumor or any other lymphoma, if it obstruct the subclavian artery or subclavian vein,
Yes.
and then it decrease the blood supply to the brain or to the upper limb. It cause subclavian
Occlusion of which vessel it causes?
is a subclavian vein or subclavian artery.
Proximal to vertebral artery. Okay, can you
Proximal to,
please
yes.
tell me what is thoracic outlet syndrome?
So this is a neurovascular symptom due to the block of thoracic outlet,
Yes.
and then it might cause obstruction of the brachial plexus and obstruction of the subclavian artery.
Yes.
So it will show some symptom of neurovascular bundle block.
Where exactly is it located? Can you please tell me the exact location?
Okay, so the exact location is bounded by clavicle and sternum in both sides, and
between scalenus medius and scalenus anterior.
scalenus medius and scalenus anterior.
Yes. And patient would present with what type of sign and symptoms?
So patient might have tingling sensation of the
Yes.
upper limb and maybe motor affection of the
So neurological and vascular
yes, neurological and
symptoms
vascular symptom
of the arm.
of the arm.
Yes.
Yes.
Good. Thank you.